This video module will provide an overview of opioids. The opium poppy has been around since 3400 BC. We're going to start with providing terms and definitions of these compounds. Opium refers to a mixture of alkaloids from the poppy seed. Opiates usually refers to naturally occurring alkaloids, and in our case, this is specifically just morphine. Opioid is a broad term used to describe all compounds that work at the opioid receptor. Narcotic comes from the Greek word meaning stupor, was originally used to describe medications used for sleep, but now it is a legal term that is used for opioids that are abused. In the healthcare setting, when we're using these medications for management of pain, the most appropriate and accurate term is opioid. Opiates is not entirely accurate unless you're just talking about morphine, and narcotic is inappropriate. Now we're going to talk about the different opioid mechanisms of action. The opioids bind to the opioid receptor in the spinal cord and inhibit the transmission of nociceptive pain from the periphery to the spinal cord. They also bind to the opioid receptors in the brain and enhance modulation and the other inhibitory pathways. And they bind to the opioid receptor in the periphery, and this becomes of interest when you're talking about topical morphine or other opioids in wound care, or when you're talking about opioid antagonist or binding to the opioid receptor for adverse effects in the gut. So the indication of opioids is for moderate to severe pain that you would not anticipate would respond to non-opioids alone. The role in therapy is for acute pain, such as a trauma or a postoperative pain, cancer pain, chronic non-cancer pain that has not, let's go back to chronic non-cancer pain. And this is chronic non-cancer pain that has not responded to non-opioids. Now, breaking that down, opioids can be used for visceral and somatic pain. It can also be used for neuropathic pain, and we'll talk about this more in detail when we go over neuropathic pain. But you need to use higher doses for opioids to be effective for neuropathic pain. Other indications of opioids include cough. So codeine syrup products are usually used for cough. Antidiarrheal products such as loperamide and diphenoxylate, and low-dose opioids have been also used to treat dyspnea. Here are a list of the opioids, and the ones that I'd like you to focus on are morphine, hydromorphone, hydrocodone, oxycodone, fentanyl, and then to add a few more from what was previously mentioned, methadone and tramadol and tapentadol. The different opioid formulations are summarized in this chart. Opioids can come in immediate release tablets or capsules. They can come in oral solutions or suspensions. Some come in sustained release or controlled release tablets or capsules. The ones that you see more commonly are morphine, which is a Q12-hour formulation in most cases, and oxycodone, which is also a Q12-hour formulation. Parenteral, so IV formulations. Morphine and hydromorphone can also be given and administered rectally. Transdermal opioid formulations, main ones are fentanyl and buprenorphine. Fentanyl is a common one used in pain management, and it's a Q72-hour patch. And then transmucosal, using the oral mucosa. The ones that are FDA approved are methadone, fentanyl, and buprenorphine. As you can see, they have the higher absorption rates at 34, 51, and 55%. But you can use the concentrated solutions of morphine oxycodone and the hydromorphone tablets and administer it transmucosally as well. It's not going to get you the higher absorption concentrations, but it can still be used.